KVH and KCHN work together both on specific objectives in the community, whether that be childcare or care coordination or behavioral health, as well as providing support. KCHN helps us with the care coordination. We provide grant writing. Our CEO and chief medical officer sit on the KCHN board. At various times, we've had members of our team that were chairing work groups. The collaboration is very close, and we do a lot to support KCHN, especially with in-kind donations, such as grant writing.
KVH has been a key supporter of the network since its formation and before that, just in its infancy. And that's come in the form of a lot of different in-kind donations as well as grant writing. So KVH has helped us with our accounting, with HR, with IT kind of stuff. So really all the stuff necessary to really start an organization. But I think also just, thinking about the network as a group of organizations that have come together to work on community health improvement, KVH has really been at the forefront of that and making sure that their efforts on community health improvement are aligned and really go through this network of organizations in the community.
So at this point, the care coordination group has probably touched about 250 people. Not all of those rise to the attention of the A-team. A-team itself has a longer history and has probably touched about 150 at this point. And if I'm off on those numbers, I'm off on the low side on both of them. It's been a few years since we counted the people A-team had touched, and at that time it was about 100. That support can be as simple as a ramp so that somebody can get out of their house and make it to dialysis without having to call EMS 6 times a week. It has been as elaborate as obtaining guardianship and liquidating properties for somebody who wasn't able to make safe decisions for themselves, but had no other decision maker. In terms of the behavioral health work group, that group from KCHN was instrumental in building consensus for the county's 0.1% sales and use tax in support of mental health and substance use disorders. There's a lot of things that the network has impacted, and I don't want to say extended KVH's reach. It's probably more accurate to say has extended the reach of public health, because a lot of the things that the network does really are around population health. One of the reasons the network exists is every partner in the organization has strengths and weaknesses. KVH is good at taking care of people when they're sick and when they need it. We're not good at population health. That's not a skill set that we've developed. We've started developing it in our work when we were doing ACO work, but we're really reliant on the network to get out and do some of that broader work. When the network first started, the network's strategic plan was the 2017 CHA-CHIP very explicitly, which means that the network took on as part of its strategic work, improving the built environment so that it's easier to make healthy choices like walking. There's a whole lot of benefit that KVH patients have gotten from KCHN, whether they see it or not.
One of the key functions of a local public health department is community assessment and community improvement planning. And so health departments are really tasked with doing a broad community health assessment and using that data to then inform a community health improvement plan. Other organizations, such as KVH, have requirements or standards around community health assessment and improvement planning as well. So it all aligns really nicely. The health department really has the skill set to be the lead in working on that community health assessment and facilitating that planning process. And the network was really, like Dr. Martin said, the network originally adopted the community health improvement plan as as its work moving forward. So in a lot of ways, it was really created to be the implementation piece of the community health improvement plan, which was really good timing in that it lined up with the planning process back when the network was being formed in 2017, and really allowed our community to come together to improve population health, like Dr. Martin said. KCHN is the network, it's a consortium, it's a collaboration, whatever you want to call it, of organizations in Kittitas County that have come together to make a broader impact on community health under the premise that, you know, together we can do more. We can have a bigger impact if we're communicating with each other, if we're coordinating services, if we're talking about, you know, where are the gaps that we see and how can we work together to fill those gaps. It's a completely inclusive organization. So we have new organizations that kind of pop up all the time that hear about us or that are just getting started themselves and want to become involved in the community and in community health improvement efforts. The network started when we actually established the 501c3, there was 10 organizations that were participating and that kind of made up the network. We now have about 60 organizations that participate in the network in a variety of ways, whether it's in the board of directors or in our leadership council or in our work groups that focus on specific issues and actually implementing change in the community. So it's welcoming to anybody who wants to participate, community members as well as community organizations. We're at a really pivotal point right now where there's a new community health improvement plan being developed. And so, you know, we're starting to kind of look forward and see like, okay, how does that align with the current work that we're doing? Because we don't want to lose momentum on all the great work that's happened, but we also want to recognize that communities change and community priorities can change. And, you know, we know that in the past 5 years, our community, the world has changed quite a bit. And so we have to be able to be responsive to those changes and those needs that come up. So right now we're really in that kind of transition place where we're looking at the new community health improvement plan, figuring out where it aligns with the work that we're doing, and then what are, you know, some new directions that it might be taking us, and how we as the network, as this organization of community agencies, can kind of pool our resources, so to say, to implement that plan. KVH has been a really huge participant in our efforts to increase access to childcare in Kittitas County, and was really one of the main reasons why we were able to get a grant from the Department of Commerce for a local childcare center, Happy Feet Academy, to build a new center that's going to add over 100 spots, childcare spots in our community, which is huge. It's a really big deal, and KVH has supported that both monetarily as well as just being involved in the entire process, helping to write that grant. And that's just going to have a big impact on the community. The other thing that really comes to mind is just KVH's participation and strides in working with substance use disorder in our community, establishing, you know, an addiction medicine program. There's been an increase in the number of providers who prescribe medication-assisted treatment from the time when we started the network to now. And so I think that there's been just a lot of really great work happening there as well.
One of the questions that was discussed as part of the original planning grant was, how will you know when you've arrived? How will you know when you've created the network that you want? And my answer was, when we stop introducing ourselves by the organization we represent and talk more about what our role is in the network. And I think we hit that about 2 annual meetings ago, where people know I'm KVH. They need to know that I'm there as part of the care coordination work group. People know that Julie is KVH, but she's there as the treasurer. What was well underway before the pandemic, but I think really in my mind was what allowed this community to do as well as it did through the pandemic. And I think KCHN was somewhat foundational in that, is that we were able to do that work without ego. In the early days of the network, it was, here's why I'm the most important to this person's experience across their life. And we've gotten to, here are the tools that I can bring to help this person, and here are the tools you can bring, and what can we do together. The A-Team was really the genesis of the network, and we were doing what we thought was important work in terms of supporting people living where they could live in the least restrictive way possible. As Robin said, there were 10 organizations at the table, including Medic One, KVFR, all three assisted livings, Prestige, KVH, CHCW, Comprehensive, Aging and Long-Term Care, and I'm probably missing a couple. But
Public health.
public health. They were one of the first additions. That group kind of became the foundation for what's now the care coordination work. And our hope then was that we could develop some mechanism where we could reach more people than the dozen or so that we could handle at any given time in terms of high utilizers, people who were failing in their current situation. Skip forward 7 years, the care coordination work group does a lot of invisible work in terms of getting people to appointments, in terms of figuring out what they need, in terms of helping them navigate healthcare. But there are still a subset of those whose needs are more significant. Frequently folks who, for whatever reason, are having difficulty making decisions that to you and I would seem to be obviously in their own best interest. And the A-Team is currently constituted with KCHN community health workers and community paramedics, does an excellent job of coming alongside folks and supporting them and helping guide them to better choices, whether that's safer housing or whether that's abstinence and recovery. It really has developed a much broader scope than it had 7 years ago and is able to get further upstream, which is what we all wanted long ago and far away. To me, what this network has done, and it's why I still give it a ton of my time, is it's shown how neighbors can care for each other. And quite frankly, true healthcare system, caring for our neighbors, caring for our friends, than any system, quote unquote, that we have for the treatment of disease. And I don't know that it would have started anywhere but here. And that's one of the reasons that I've put down roots.
I don't think I could say it better. You know, the only thing I would add is that what I really see in the network is that we really strive to meet people where they're at and to see people as human beings and recognize that everybody has different challenges and they may or may not be ones that we're familiar with, but we're here to learn and we're here to help people on their path to health and well-being, whatever that might look like.